This is CBS 6 News, now in high definition.
Within the hour, the largest health provider in the area will be born. The Federal Trade Commission has signed off on a plan that will merge St. Peter's Hospital in Albany with Troy's Northeast Health and Seton Health systems. That means Samaritan and St. Mary's hospitals in Troy and St. Peter's and Memorial hospitals in Albany, and they employ thousands of healthcare workers at dozens of facilities, will consolidate their operations.
This is YNN, your evening news now.
Three healthcare facilities in the capital region will soon become one. The CEOs of Northeast Health, Seton Health, and St. Peter's Health announced the merger plans. Hospital officials say that every attempt will be made to avoid any layoffs. The merger of three healthcare facilities can move forward. That according to the Federal Trade Commission. After about a year-long review by the FTC, the CEOs of Northeast Health, Seton Health, and St. Peter's Health were told that their proposed merger would not be challenged. Held a news conference Thursday to announce what's next. Late August is a tentative start for the merger, but says that full integration may take several years. St. Peter's CEO says this plan is worth the wait.
But the real beneficiaries of this is the citizens, the people of this region, who will, we believe, benefit from a more integrated healthcare system which will provide high quality access at a low cost.
Boyle says the four hospitals run by the three organizations will not close. Those are St. Peter's, Samaritan, St. Mary's, and Albany Memorial. He also says that every attempt will be made to avoid any layoffs.
From WNYT Albany, News Channel 13 live at 5 begins right now.
The last hurdle has been cleared for the merger between St. Peter's Healthcare, Seton Health, and Northeast Health, but it may take years before the effect on your health care shakes out.
Today is a day of marriages and mergers.
With far less flourish than the royal wedding, this triumvirate of hospital honchos announced their good news. The Federal Trade Commission, after review of merger plans between St. Peter's Healthcare, Seton Health, and Northeast Health, decided not to take any action, clearing the way for the merger to proceed. And while there's much work to be done, the hospital execs say nothing will stop them now.
So we're all very comfortable that we've done our homework and there won't be any surprises.
When the merger is completed, and that paperwork is expected to be signed by summer's end, a corporation with a budget topping $1 billion will be created, making the merged entity the second largest employer in the capital region behind the state. 10,000 to 12,000 people will be employed. While no one can promise no jobs will be lost, the hospital execs say some job descriptions will change, but that they'll work with employees to help them adapt. Bottom line to all this is an effort to reduce duplication of services and hold the line on costs.
Fragmentation of care has been one of the real flaws in the healthcare system in America, and we think we have the solution to that flaw in bringing our organizations together.
Signing the paperwork is only a start.
You can picture the number of moving parts in this merger that we're putting together. As you move one thing, it affects something else, so everything needs to be phased.
It could be 3 years before all the work's completed. Hopefully, they'll come up with a new name for the organization before then. And the other big hospital locally, Albany Medical Center, says it recognizes the need to hold down health care costs and that the merger makes sense from that perspective. AMC says it will continue to support the community hospitals by providing care for patients needing more complex services.
Next step, the Fed sign off on a merger plan among St. Peter's, Northeast Health, and Seton Health. The latest on the plan, why some could be done by the end of the summer and some parts of it could take years.
From the 10 o'clock news team, Fox 23 News at 5 starts right now.
Now, plans to merge three area healthcare groups into just one is a big step closer to happening tonight. Federal regulators have signed off on the deal to join St. Peter's, Northeast Health, and Seton Health. Fox 23's Walt McClure live outside St. Peter's Hospital in Albany with more on what happens next. Walt.
Well, John, the key to this okay is that what was proprietary information can now be accessed by all three groups to decide what to do with the assets each brings to the table. Close to 3 years after initial discussions began, the pieces of the plan to merge St. Peter's, Northeast Health, and Seton Health into the Capital Region's largest healthcare provider could begin to fall into place by Labor Day.
The real beneficiaries of this is the citizens, the people of this region, who will, we believe, benefit from a more integrated healthcare system.
The biggest thing about getting the Federal Trade Commission's blessing is it allows everyone access to all the information for detailed discussions about pooling their resources into a single 12,000 employee, 125 facility operation. The initial plan already laid out keeps all 4 acute care hospitals open with emergency rooms, as well as Sunnyview in Schenectady. Samaritan will become Troy's inpatient medical surgery facility. St. Mary's would be home to cancer and behavioral health centers. Memorial stays a community hospital, and St. Peter's houses major specialized care.
We believe that by combining the complementary strengths of our organizations, we're going to be able to significantly improve our ability to serve the people in this community.
We really hope to be able to deliver services that are more friendly to our patients, more friendly to our physicians, make it truly the best place for everyone.
Meetings to integrate clinical services could be done by the end of summer, but it could take up to 3 years, and some staffers changing jobs to create the well-oiled machine they envision.
It will require flexibility on the part of our employees, and it will require, in some cases, new skills, which we are willing to help them develop.
Now, all the CEOs say that they will do their best to avoid cutting any job cuts other than through attrition. We provided a link to some more information on this merger plan, more details on our website, fox23news.com. We're live in Albany tonight. Walt McClure, Fox 23 News.
Live from WTEN, this is News 10 at 5:30 on the news station.
Hospitals unite. A new merger will bring some big changes for healthcare in the Capital Region. Good evening and thanks for staying with us. I'm Lydia Colbeda.
And I'm Elisa Streeter. After more than 3 years of planning, St. Peter's, Northeast Health, and Seton Health System have received the official go-ahead to merge their operations.
News 10's Amy Cutler was at the announcement today and shows us what those changes will mean for you.
The Federal Trade Commission has signed off on a deal allowing St. Peter's, Northeast Health, and Seton Health System to merge, becoming the largest healthcare provider in the area.
We want to redesign the way we offer the services so we become more efficient. That's a better patient experience, higher quality, but it's also a more cost-efficient approach.
Here's what the reconfiguring will look like. In Troy, Samaritan Hospital will handle inpatient care and surgery, host the maternity hospital and cardiac lab. Seton St. Mary's will have the Cancer Treatment Center and Behavioral Health Center. Meanwhile, in Albany, Albany Memorial will handle short-stay surgery, while St. Peter's Hospital will do complex surgery, inpatient care, and cancer treatment. Hospital officials say it's not just about consolidation, but growth. The new system will have nearly 12,000 employees and 125 locations, creating greater access to care.
There'll be many opportunities for our staff, and it will create a stable employer, if you will, with the size that we will be.
We will guarantee we will make every effort to preserve jobs.
There's still no name for the new system, and hospital officials stress the merger will take years.
When are you going to see something different? Those, as I said before, that's what's going to roll out gradually.
Now, the FTC approval allows these hospitals to share more detailed information, and that access they hope to have a blueprint in place by the end of the summer. Coming up at 6, I'll have more on one service the new system will not provide. Amy Cutler, News 10.
From WNYT, Albany, News Channel 13, live at 6, begins right now.
Coming up, the changing face of healthcare in the Capital Region. 3 providers get the okay from the feds to join forces. What it means for patients and employees.
Welcome back. With the combined budget topping $1 billion a year, St. Peter's Healthcare, Seton Health, and Northeast Health are on the verge of becoming the area's second largest employer after the state.
The 3 healthcare providers today announced they cleared the final hurdle for a merger. The Federal Trade Commission decided not to take any action, which means the merger can go through. Now it's time for the hospitals to work overtime to get the deal done.
The
Renovation work at St. Peter's Hospital is a metaphor for the merger that will marry this hospital's fortunes with Seton Health and Northeast Health. It's a work in progress and one that will create something new.
To redesign the healthcare system and the business model that underlies that healthcare system.
Paperwork finalizing the merger is expected to be signed by summer's end. But this trio says it may take up to 3 years before the new organization is fully realized. In part, that's due to getting the state health department to sign off on many of the big changes, and in part because until the FTC said it wouldn't stand in the way, the groups couldn't, by law, share the nitty-gritty of their businesses.
We think this is an opportunity to innovate in ways that we haven't been able to in the past because we simply haven't been able to bring all these resources together.
The healthcare organizations bring very different philosophies. St. Peter's and Seton have Catholic affiliations. Northeast Health will continue to be a secular organization and oversee the Burdett Care Center, a women's health center adjacent to Samaritan Hospital in Troy. Burdett Care will be operational, we're told, the day before day one of the new corporation. The maternity services currently at St. Mary's Hospital, part of Seton Health, will move to Burdett Care, probably by year's end.
We are different cultures, we're different organizations, but we have clearly determined that there's more that binds us than not.
10,000 to 12,000 people will be employed by the merged group. The goal is to keep all the jobs, but many may be restructured.
We're not starting out with on the premise that we're going to close locations. In fact, remember now, one of our goals here is access.
And what will this new organization be called? If you've got a suggestion, they're listening. Now, these merger talks began back in August 2009. Burdett Healthcare, a women's health center, will be the first facility to open when that merger is inked.
This is News 10 at 6 on the news station.
Big changes coming to healthcare in our area. Plans to merge Northeast Health, St. Peter's, and Seton Health got the go-ahead. News 10's Amy Cutler joins us now with more on what this change will mean for patients. Amy?
Lydia, in the short term, if you use one of their doctors, you won't notice a change. But over the next few years, hospital officials are saying the merger will reduce costs and improve care. The CEOs of St. Peter's, Northeast Health, and Seton Health System coming together at St. Peter's to announce they've received approval from the Federal Trade Commission to merge. This was the last step in their plans, which have been 3 years in the making. With nearly 12,000 employees and 125 locations, the deal will make this new system the largest healthcare provider in the area. Hospital officials say it's not just about consolidation, but growth.
We have plans to close nothing at this moment, but subject to what we learn, will there be opportunities and would it make sense? We don't know, but if those present themselves, of course we will.
Now, the one service this new system will not provide is abortions. Hospital officials say they've determined most women opt for private doctors' offices for those procedures. Now, they estimate it will take 3 years before the merger is fully complete. Amy Cutler, News 10.
This is YNN, your evening news now.
A decision has been reached in regards to a possible merger of area hospitals. Our Megan Cruz has the details.
By combining the complementary strengths of our organizations, we're going to be able to significantly improve our ability to serve the people in this community.
The Federal Trade Commission agrees and has given the go-ahead for a merger of 3 Capital Region healthcare organizations.
We're now able to go forward to be able to begin to actually do the work.
To make 3 into 1. Northeast Health, Seton Health, and St. Peter's Health held a news conference Friday to announce what's next.
This is an opportunity to innovate in ways that we haven't been able to in the past.
We really hope to be able to deliver services that are more friendly to our patients, more friendly to our physicians, make it truly the best place for everyone.
But what does this mean for St. Mary's, St. Peter's, Samaritan, Albany Memorial? The 4 hospitals and 121 other care facilities are currently operated by the 3 organizations.
We're not starting out with on the premise that we're going to close locations. In fact, remember now, one of our goals here is access, and all those locations provide access.
But most mergers do mean layoffs.
And that is specifically not this merger. This merger is not designed to reduce staff at all.
Hospital leaders say full integration of the 3 organizations will take several years, but they hope to begin that process in late August. As for the new name,
no. We're working on it, though, and it's really easy, too.
And once the merger is complete, the new organization will be the largest employer in the capital region, second only to New York State. Reporting in Albany, Megan Cruz, YNN.
And they are three of the area's biggest healthcare providers, and they are a big step closer tonight to merging. What does that mean for you and your doctor? Some answers next.
A major capital region healthcare merger is one big step closer to being finalized tonight.
The Federal Trade Commission approved a plan for St. Peter's, Northeast Health, and Seton Health to combine into the area's largest healthcare provider. Fox 23's Walt McClure has details.
Close to 3 years after initial discussions began, the pieces of the plan to merge St. Peter's, Northeast Health, and Seton Health into the capital region's largest healthcare provider could begin to fall into place by Labor Day.
The real beneficiaries of this is the citizens, the people of this region, who will, we believe, benefit from a more integrated healthcare system.
The biggest thing about getting the Federal Trade Commission's blessing is it allows everyone access to all the information for detailed discussions about pooling their resources into a single 12,000 employee, 125 facility operation. The initial plan already laid out keeps all 4 acute care hospitals open with emergency rooms, as well as Sunnyview in Schenectady. Samaritan will become Troy's inpatient medical surgery facility. St. Mary's would be home to cancer and behavioral health centers. Memorial stays a community hospital, and St. Peter's houses major specialized care.
We believe that by combining the complementary strengths of our organizations, we're going to be able to significantly improve our ability to serve the people in this community.
We really hope to be able to deliver services that are more friendly to our patients, more friendly to our physicians, make it truly the best place for everyone.
Meetings to integrate clinical services could be done by the end of summer, but it could take up to 3 years, and some staffers changing jobs to create the well-oiled machine they envision.
It will require flexibility on the part of our employees, and it will require, in some cases, new skills, which we are willing